Imagine waking up with the worst toothache of your life. Every heartbeat sends another pulse through your jaw. You cannot eat, you cannot sleep. Even cold air feels like a knife inside your mouth. Now, remove the dentist. Remove antibiotics, x-rays, numbing injections, and painkillers. The nearest person with dental training will not be born for thousands of years. So, what do you do? For most of human history, a toothache was not a small inconvenience. It could become a permanent source of agony, and if infections spread beyond the tooth, it could become deadly. Yet ancient humans did not simply sit around and suffer. They experimented, improvised, and sometimes performed procedures that looked disturbingly similar to dentistry. The story begins before cities, writing, or agriculture.
In northern Italy, researchers examined the tooth of a young man who lived around 14,000 years ago. Inside one cavity, they found unusual scratch marks. Microscopic analysis suggested that someone had deliberately scraped the decayed area with a tiny pointed stone tool. Picture the procedure. You lie on the ground while another person holds your head still. There is no anesthesia, no drill. Just a sharpened piece of stone repeatedly entering a hole in your tooth. It sounds horrifying, but the person doing it understood something important. The painful material inside the cavity needed to be removed. This may be the earliest known evidence of humans deliberately treating tooth decay, and it did not end there.
At a Neolithic cemetery in what is now Pakistan, archaeologists discovered molars with remarkably precise holes. The teeth were roughly 9,000 years old. Researchers believe the holes were made using bow drills, the same basic tools craftspeople use to drill beads. A cord wrapped around a shaft could spin a tiny stone tip backward and forward at high speed. Someone looked at that tool and apparently thought, what if we put it inside a human mouth? Experiments showed that a skilled operator could drill a tooth in less than a minute. But even 1 minute would have felt extremely long to the patient. Then, around 6,500 years ago, someone may have attempted a filling.
A cracked canine tooth found in Slovenia contained beeswax packed into the damaged area. Researchers cannot prove with complete certainty that the wax was added while the person was alive, but if it was, the beeswax may have covered exposed sensitive tissue and reduced the pain. Stone tools, bow drills, beeswax fillings. Prehistoric dentistry was crude, but it was not mindless. So why were damaged teeth becoming such a serious problem? Hunter-gatherers could develop cavities, especially when their diets contained sweet or starchy wild foods. But in many populations, tooth decay increased after humans adopted agriculture. Grain provided reliable calories. It also provided oral bacteria with fermentable carbohydrates. Those bacteria produced acids that attacked tooth enamel. Farming helped support larger civilizations, but it also helped create a world with more aching teeth.
Once writing appeared, we begin to see how ancient societies explained that pain. In Mesopotamia, one famous explanation blamed the tooth worm. People imagined a tiny creature living inside the tooth, drinking its blood and chewing through its roots. If you have ever felt a toothache throbbing as if something alive were trapped inside it, the idea almost makes emotional sense. Treatments combined practical substances with magic. One Mesopotamian remedy involved heating henbane seed and beeswax, then directing the smoke toward the damaged tooth. Other preparations used salt, juniper, and plant compounds, sometimes accompanied by spoken incantations. The worm was imaginary. The pain relief may not have been. Some plants used by ancient healers contain chemicals capable of dulling pain, reducing inflammation, or slowing bacterial growth. But dosage was unpredictable, and some remedies could also be poisonous. Ancient Egyptians recorded mixtures intended to stabilize painful or loose teeth. Ingredients included honey, plant material, and mineral compounds packed around the tooth and gums. Honey could inhibit some microorganisms, while thick pastes may have temporarily protected irritated tissue. But these treatments could not repair a deep infection. When everything else failed, there was one permanent solution: remove the tooth. That was more complicated than it sounds. A diseased tooth can break during extraction. Roots can remain trapped in the jaw. Dirty instruments can introduce new infections, and severe bleeding can create another emergency. Greek and Roman writers later described dental problems and extraction tools. During medieval periods, tooth removal was sometimes performed by barber surgeons, the same people who cut hair, shaved beards, drained blood, and carried out minor operations.
There was no modern local anesthetic. Patients might use alcohol, herbal sedatives, or simply physical restraint. Speed was part of the treatment, and the person pulling the tooth did not always pull the correct one. Still, extraction could end unbearable pain and remove a dangerous source of infection. For some patients, a terrifying procedure was also their best chance of survival. But ancient people had another advantage that is easy to overlook. Their teeth were built exactly like ours, but their environments were different. Many communities consumed far less refined sugar. Fibrous foods required heavy chewing and produced more tooth wear, but they did not always create the same pattern of decay seen with modern sugary diets. Some groups also chewed antibacterial plants or used fibrous sticks to clean their teeth. At an ancient cemetery in Sudan, researchers found evidence that people consumed purple nutsedge, a plant capable of inhibiting a major cavity-causing bacterium. That may help explain their unexpectedly low level of tooth decay. Ancient humans did not possess perfect teeth. Their remains show cavities, abscesses, worn enamel, gum disease, and teeth lost long before death. They survived through a mixture of diet, luck, medicinal plants, improvised procedures, and an extraordinary tolerance for pain. Modern dentistry transformed that experience. Anesthesia removed much of the terror. Germ theory revealed the role of infection. X-rays allowed dentists to see what was hidden inside the jaw. Antibiotics helped control dangerous bacterial spread. Today, a dentist can numb your mouth, remove decay, and rebuild a tooth before lunch.
14,000 years ago, someone attempted the same basic mission with a sharp stone. So the next time you hear a dental drill and feel nervous, remember the alternative. No numbing injection, no sterile room, no trained dentist. Just you, your toothache, and someone approaching your mouth with a rock.